Thanks for joining us for T&T Open Mind Insights. Glad to have you here. I was wondering if you could tell us a little bit about you, what you do, why you do it, how you do it, if that's okay.
Yeah, of
All right.
course. Thank you for having me. I'm,
Yeah.
I'm glad to be here. So, I am a combined board certified internal medicine and pediatrics primary care physician. I am working over in Carson City, Nevada, and it's at an FQHC, so federally qualified health center, working with a lot of kind of underserved and uninsured
Hmm.
populations. I am really passionate about primary care, preventative medicine,
Yeah.
but especially working with underserved populations.
Okay.
I think as a kid, as a teenager, and then into college, I was always very socially involved, very active. I grew up in DC, so I was going to lots of protests, and
Do they have protests in DC?
a
I've
couple,
seen.
yeah, occasionally.
All right.
And I just wanted to find a way to really improve circumstances in this country and kind of make a difference in the world.
Yeah.
And kind of throughout course of my undergrad and my master's, I really found that medicine's the perfect avenue for that because you
Mhm.
can get to know people, one, on an intimate basis, but two, we know that healthcare is plays such a huge role in education, in social economic, status,
Mhm.
in
Mhm.
in race, in every aspect of our lives,
Yeah.
and so that's kind of why I do what I do.
So I was only smart enough to do internal medicine, just one of those, not peds. Tell me, why did you do med peds or internal medicine in pediatrics?
Yeah, yeah. So it's funny when I got into medical school, I thought I was going to do like OB-GYN, and I realized I couldn't do the operating room. I hated I
Okay.
hated the OR. But I was really looking for an avenue, and where can I make a big difference in people's lives, and where is that need? And
Yeah.
I did. I found I had a love for treating all ages, from your 26-year-old with anxiety to your 54-year-old with hypertension and diabetes
Yeah.
to your 3-year-old who's just a normal, healthy kid, but maybe there's some behaviors there that we could improve upon so that
Mhm.
they continue to be healthy. Um, a big question I always get though is why not family medicine?
Yeah,
And
yeah.
so one of the, again, knowing I have this passion for underserved communities, and having been privileged enough to work in a lot of different communities even
Mhm.
before my training, I found that oftentimes when people from the uninsured, underinsured, or the underserved, by the time they actually present to healthcare, their health process or their disease process is much further along,
Yeah.
much more advanced. An example I always give is I did some mission work in Haiti, and it was not uncommon for people to walk into our little clinic that we set up in a church, in the middle of nowhere,
Yeah.
with blood pressures 220s over 120s.
Yeah.
And we couldn't just knee jerk send them to the ER. The ER was 4 hours away with no way to get there and no money to pay for it. And so you have to get comfortable in caring for sick people with low resources. And I just felt like internal medicine and pediatrics allowed some of that acute care
Yeah.
training. So I got a lot of training in the hospital, that I can then kind of take into my outside practice.
You had to get advanced training in order to work with patients who you thought in the future, you're
Mhm.
present now, would have advanced disease process.
Yeah.
Wow. And
Yeah.
and so why Carson City, Nevada?
Yeah.
Yeah.
So I'm a mountains girl. I
Okay.
love to snowboard. I love to hike. I like to rock climb. I like to get out in nature. And
Okay.
so I can't say enough great things about my training in Florida. I did my medical school and my residency in Florida.
Mhm.
Um, it just was too flat.
Yeah.
So when I was, graduating residency, looking for a job, I was looking at a bunch of federally qualifying health centers
Uh-huh.
in, kind of the mountainous areas. And I interviewed at a bunch of them, and this just seemed like the best fit for me, and I'm loving it so far.
So Nevada, when I think of, is it Reno? That's the biggest little city, right?
Yeah.
Yeah. What is Carson City then?
The capital city, believe it or not.
Well, it's the capital city.
Yeah, and it's only about 20 miles south of Reno.
Okay.
Um, But what's wild, what I've been learning since living there is it's so much more rural than I expected. Carson's only about 70,000, I believe. Reno itself is only, I think, like in the 200, 300,000
Yeah,
population. But then, at my clinic in Carson, we get a lot of people from outlying,
yeah.
towns that are population 2,000, 8,000, traveling 45 minutes to get
Wow.
to me, and really like not a lot of resources.
What's the state of mental health care or behavioral health care delivery in the region in which you work?
Terrible.
Terrible.
Yeah.
Why is it terrible?
I think that there's just not a lot of services. I don't think there's enough psychiatrists or psychologists, mental health, providers. Two, I think that monetary access and insurance is a big issue. Some of my pediatric patients that I have that I refer and they have private insurance, they're able to get in.
Yeah.
There's a bit of a wait list, but a lot of my Medicaid or my uninsured, they're being told that they're the closest providers in Las Vegas, which is an 8-hour drive
How
away.
many hours?
8.
So the only way they can get care from a specialist in mental health would be to drive 8 hours, fly 8 hours, or fly to Las Vegas.
Right.
Wow.
Yeah.
So if they can't do that or they don't do that, who delivers the care? Who works with them to help them with their behavioral health issue?
Me.
You.
Yeah.
But how can you do that?
It's hard.
It is hard.
It's hard. I mean, I'm trying to make it happen. But there just isn't other options. A great example, I have a teenager I saw in clinic. I've met him a couple times. We've worked
Yeah.
on some other things together, but about 3 weeks ago, he basically unveiled to me that he is seeing shadow people who
Oh,
follow him and talk to him and scream at him, and he's having near daily passive thoughts of suicide.
wow.
And so, like most pediatricians or primary care doctors would do,
Yeah.
stat referral to psychology, stat referral to psychiatry. Make some calls, see what we can do. Come up with a safety contract with him,
Yeah.
and I had him come back 2 weeks later. So I just saw him actually yesterday.
What's the plan for him from a psychiatric standpoint?
So, I mean, because my concern is this a major depressive disorder with psychotic features? Is this a schizophrenia? Is it, what kind of is going on? Because I just didn't really get that training.
You're not sure about the diagnosis.
Right,
Okay.
exactly. And so that's why I wanted to get him in with a trained, psychiatrist or mental health provider, and yeah, nowhere will take his Medicaid.
Wow. Except 8 hours away.
Right, which the family just can't do.
No. Well, first, that's just horrible,
Yeah,
right?
yeah.
And not only for your patient, but I would guess for you and your colleagues. You're in a situation where you can't really help these folks.
Hmm.
And I'm guessing, based on what you're telling me, that you received very limited, probably suboptimal training in the area of psychiatry formerly when you were a resident.
Yeah. Yeah. I mean, I don't want to say necessarily suboptimal. I think that my program did a really good job of trying, because we are seeing increasing. And I have the luxury that I just graduated residency 6 months ago.
Oh, okay.
So, and I think we are seeing such an increase in mental health in this country, especially after COVID. I think that kind of blew the lid on
Yeah.
allowing it to kind of be normal and talked about and okay.
Yeah.
And so, they did try to give us, so, your run of the mill depression, your run of the mill anxiety, I actually feel comfortable with,
Okay.
which might be different than some of the pediatricians I meet that graduated residency several years ago. Um, but you're more kind of like psychotic
But
disorders
there's
and
not time during
right. Oh,
residency
yeah.
to learn about psychotic disorders or even substance use disorders
No.
or even depression that doesn't work after the first antidepressant.
Right.
There's the heart and there's the lung and
Mm-hmm.
there's the kidneys and there's a lot of stuff to learn about.
Thyroid, the adrenals. Yeah.
All of it, right? So it's hard in that amount of time formally
Yeah.
to learn about psychiatry.
Yeah.
I think a lot of programs really do their best, like yours,
Mhm.
but it can be difficult, right?
Yeah. 100%.
So you have enrolled in a program
Mhm.
to help you give you a boost
Mhm.
within a year, and you keep your job
Mhm.
while you're learning,
Yeah.
so you can still work. Um, but to give you a boost in the area of how do you diagnose this stuff? How do you treat it?
Mhm.
Particularly while you're waiting for a referral that could take many, many months.
Yeah.
Um, have you started this program yet?
Yeah, so today is actually our first kind of kickoff. So we are spending today and tomorrow in kind of in person, like seminars, lectures sounds a little too, college, but in person seminars, learning kind of, it's almost like an intro to a lot of the different psychiatric conditions that we see in child and adolescents.
Okay.
And then for the next year, I will be doing couple times a month. They have various different things. So there's like lunchtime lectures, there's sort of after hours like small group seminars, there's kind of office hour mentoring, one-on-one or in small group, and then there will be some more in person down the road, but yeah.
As a disclosure, I'm the director of the Trainee Trainers program, so I have to, and I also have to disclose that probably to everyone who's listening. But I'm glad that you're in this,
Mhm.
and the program is so important because most pediatricians in the United States don't get that robust training for the adolescent, for example, who's hearing voices or seeing
Mhm.
shadows, and that can be pretty scary.
Mhm.
10% of people who have schizophrenia end up dying by way of suicide,
Yeah.
and that's a huge number when you
Yeah.
compare to the
So sad.
when you compare to the general patient population, and it's not good.
Yeah.
So I'm glad you're doing this. I really am, because a big part of this train new trainers primary care, in your case, child adolescent or CAP
Mhm.
fellowship program, is to teach you how to train,
Right.
right,
Yeah.
in your area in Nevada.
Mhm.
Wouldn't that be cool?
Yeah. Oh, it would be great. And I know a lot of my colleagues are already so excited that I'm doing this as well, and already thinking about like lunchtime, conferences and stuff that I can do for them. So
Yeah.
it is. It's an incredible opportunity, and I'm incredibly privileged and grateful to have been accepted.
So it's only your first day,
Yeah.
but if you could try and anticipate how, if at all, this might change your practice,
Hmm.
what do you think about that?
Yeah.
Like structurally or mechanistically, would it change your practice at all?
It's a really good question. Yeah, I mean, I think, kind of in sort of the narrow, short end kind of field of vision, I think the biggest thing it's going to do is it's going to make me more comfortable diagnosing and treating, which is going to obviously help my patients on that kind of individual one-to-one basis.
Yeah.
But I am very passionate about community outreach and about education. And so it is something that I do kind of in the longer run. I would like to get other providers that I work with very comfortable and treating this, and maybe even be doing community outreach in the high schools, in the elementary schools about, obviously age specific kind of things to get more education out there. I think the more awareness, the more education that is out there, the less taboo it is, and the more likely people are to present earlier before we're getting to the point where, I am having daily thoughts of suicide, or I've been seeing these shadow people for 2 years and haven't felt comfortable telling people.
Yeah.
And so I think, that is kind of the lofty goal.
Yeah.
But it's a realistic one, I think, too. I'll be honest with you in terms of how, I don't know if I've quite gotten there yet.
Yeah.
But that's something I'm excited to do in the next year is
Mm.
apart from just learning more about psychiatry, but is really just figuring out how can we actually apply this to to real life.
Well, just based on my own experience, when you're done with this program, pretty sure you're going to feel very, very confident in making that diagnosis.
Yeah.
For example, does this patient have major depressive disorder with episodic, brief, transitory psychotic features, or does this patient have a chronic, persistent illness called schizophrenia?
Hmm.
You'll be able to make that diagnosis and feel confident about it, but then also start the treatment.
Yeah.
But it sounds to me like your plan is kind of interesting where you're going to continue being primary care doc because you love that.
Hmm.
But at the same time, you're going to become more of a teacher and mentor
Hmm.
as well,
Hmm.
using that train new trainers model potentially.
Hmm.
One of the reasons I asked you too is a lot of graduates will continue doing primary care because they love it
Hmm.
and they don't want to go anywhere. They want to stay right there where they're at.
Yeah.
But a day or 2 days a week, they might be that in office sort of triage
Mm.
for the behavioral health issues.
Yeah.
You know what I mean?
Yeah.
What do you think about that?
Oh, I mean, I would love if that was like a possible model, and maybe down the road it could get there.
Yeah.
I do have the luxury. The clinic I'm at right now, we actually have two in-house behavioral health therapists. They're social workers by trade, but so we do have that luxury that if we have
Yeah.
kind of a crisis, but even then they're limited in what they do, and so I think being able to kind of create something, work as a partnership, and create.
Yeah.
Where you can have the therapy, but then also the medical
Hmm.
parts for starting medications or actual diagnosis, etc.
The
Be great.
medical piece of it.
Yeah, exactly.
Um, you mentioned earlier that you were fortunate
Hmm.
to do this training. Can you tell me a little bit more how you got about how this happened for you or how you
Hmm.
got the training?
Yeah. So like I said, I just graduated my residency in June. So it's like 7 months ago. And I
Yeah.
just started my first big girl job back in September. So
Mhm.
about 3 or 4 months ago. And we had, a couple months ago, there was like an all provider meeting like we have on a regular basis. And there were some representatives from the organization, from TNT, and they were just presenting and talking about what it is. And I'm also very fortunate that Nevada was offering a scholarship as well.
So the state
Yeah,
put this together.
yeah, the Primary Care Association in Nevada, yeah, was
Wow.
offering the scholarship that I applied for and received, and so it's super exciting.
That tells me that there are other entities organizationally within the state of Nevada that see the importance of this
Yes,
and have invested in this.
yeah,
So you could get the training and
yeah,
other colleagues and then help your patients in these really underserved areas.
hmm,
It's exciting. That's exciting to see that.
it is.
It's almost like hopeful.
It is. I think in a time where, there's so much going on in the world and
Yeah.
we are seeing certain areas that we might not want to see get, federal funding cuts or,
Yeah.
kind of pulling back on, rolling back, et cetera. It's really nice to see these little areas where there is some hope.
Yeah. Well, I'm glad you're part of the program and that you're learning this. Um, boy, wouldn't it be cool 2, 3, 4, 5 years down the road? Who knows? Maybe you'd be a faculty member teaching this stuff on a larger scale.
Yeah,
That'd be kind of interesting,
it
wouldn't
would
it?
be. Yeah.
Is there anything that you want to share with us that you think is important? I have no idea how many people will watch this interview, but I imagine quite a bit.
Hmm.
Um, a message for folks who might be watching and maybe struggling or having a family member or friend struggling with depression or anxiety or even schizophrenia.
Yeah.
Um, message from you.
Yeah. Oof. That's a good one. I mean, I think the most important message is that they're not alone and they don't have to be alone. And there is help. These are very treatable diseases.
Yeah.
We have a lot of evidence based medicine and therapies to treat all of these conditions. And so we don't have to suffer through it alone. And there's no shame in saying that you have a problem. I mean, I myself have had PTSD, depression, anxiety, and a little hard work and a lot of support from loved ones, and it's very manageable and curable in a lot of ways.
Hmm.
And so I would say just you know asking for help, finding a trusted healthcare provider that you can talk with, and working with them, even if they themselves don't necessarily feel comfortable, working with them to find someone that does.
Yeah.
And my hope is that as time goes on, we will see more and more primary care providers getting trained and getting comfortable in psychiatry because for me, mental health is just as important as physical health and vice versa.
Depression is just as important as hypertension.
100%.
I love the word comfortable. If folks out there doing primary care, front lines care, are comfortable with this
Mhm.
stuff, like most internists are comfortable with treating high cholesterol,
Mhm.
diagnosing and treating high
Mhm.
cholesterol, or hypertension,
Yeah.
or heart failure,
Yeah.
or diabetes,
Yeah.
or hyponatremia, etc. But some of the stuff's tricky,
Mhm.
and if they're able to get more comfortable, they can initiate treatment and maybe even continue that treatment
Mhm.
without having the psychiatrist
Mhm.
involved. The psychiatrist in your case, which is 8 hours
Right.
away,
Right.
that's a long ways away, by the way.
Yeah, and even if, let's say, perfect worlds, your psychiatrist is just 10 minutes down the road, that's still another copay,
Yeah,
another doctor's visit, more time off of work, out of school. I mean,
yeah,
and so I think as much as we can do in the primary care setting, it's just going to be better for patients.
yeah. Gosh, I agree 100%. Well, congratulations for joining.
Thanks.
Um, I'd love to follow up with you in a year
Yeah.
to see how this has gone for you.
Yeah.
And also during that year, how you've been able to help your colleagues and their patients,
Yeah.
right? It's almost like an exponential gain, really.
Yeah.
Um, and they, gosh, they need you. They need you there, don't they?
Yeah.
In Nevada.
Yeah.
So it was a pleasure talking with you,
Thank
and
you.
thanks so much for taking the time and for the work that you do there with your patients. I just think it's amazing. So thank you.
Thank you. Yeah, this is great. Thank you for having me.